to Nurse Educators Now, a podcast brought to you by Collaborative Momentum Consulting. I'm Dr. Susan Sportsman, your host. We will be thinking about remediation and how we can help students to be successful in their programs. As we deal with the national nursing shortage and other factors in our healthcare environment, nursing faculty are responsible for admitting and preparing students that will be successful in our nursing programs and ultimately in clinical practice. The question is, how can we choose the students that will be successful? Today's guest, Dr. David Foley, Associate Clinical Faculty at The Ohio State University College of Nursing, has a particular interest in helping undergraduate students to be successful. His 2016 dissertation, Predicting Student Success, Influencing NCLEX Pass Rate in an Urban University Pre-Licensure Program, has informed his journey throughout this process to support students from all walks of life. Welcome, Dr. Foley. We're glad to have you.
Thank you very much for having me. I sincerely appreciate the opportunity.
Let's just jump right in. First question I have for you is that you have identified a lack of social capital as the influencing, or at least a influencing factor in lack of student success in pre-licensure programs. Could you briefly define social capital just so we'll all have sort of an idea about that and describe how it affects nursing students both positively and negatively?
Certainly. So I just wanted to start by, framing this within the context of my own life's narrative. So I grew up in an inner ring suburb of Cleveland, Ohio, inner ring meaning that it touches the urban core. And it was a post-war boom suburb with a great public school system. But by the time I came along in the early 1980s, it had lost its luster and was very financially challenged. And so in that lower middle class, working middle class suburb, I did the best I could within that public school system. I was educated by wonderful teachers in what was called the honors program. I had a great GPA. I was third in my graduating class, and I was accepted into a very prestigious accelerated program at Kent State University. And when I got to the university, I fell flat on my face. And it's very freeing for me to be able to say that. I went there with what seemingly were wonderful academic credentials. But when I began to interact with the other students from day one, it was very apparent to me that I felt like I was way out of my league. Those other students had been educated in very elite school systems. Both of their parents, for the most part, were college graduates. Many were physicians. And so in that particular program, which at that time was to lead us to a 6-year baccalaureate MD program, I felt as though I had no idea how to speak to them, how to interact with them. I had really felt like I had never been exposed to many of the experiences that they had in their lives, particularly through their schools, through the social institutions that they seemed to move through with ease. It seemed as though within their parents' social network, they knew many doctors, many people who had already successfully been through the college experience. Neither one of my parents, who are both amazing people, neither one of them had graduated from college. And so I really went there without any preparation as to how to navigate many of the academic challenges that were before me. So after struggling with that program for 3 years, I chose to leave. And I really made it the first of many note to self moments. And I said, this is going to come to some good someday. I want to do something with this to help people. And I left college for a couple of years and eventually went back and became a hospital administrator. And I did an RN hospital-based program, evening weekend program. And it was a great experience. But even then, when I was in that particular program, one of the faculty who was and this was 30 years ago, a faculty member who had been educated in the 1950s, walked to me in front of 100 of my other colleagues on the first day, pointed at me and said, "What are you doing here? There were only 3 men in the class. What are you doing here? Why are you here?" And so that really made me think about, what am I doing here? Do I have what it takes to navigate the social strata within this particular program? So I had a second of a note to self moment that I want to do something with this someday. And after I got into education a few years later, nursing education in particular, I began to really consider and do a lot of reading on the concept of social capital, which means that as we're growing up, all of us interact with people in our social circles, in our churches, in our communities. in our schools. And for some students in upper and upper middle class socioeconomic strata, those students have access to a lot of social connections who can act as mentors, who can act as very much empowerment agents. And for me, growing up in a lower middle class school system, I didn't have access to those sources. So I began to consider this, that it would be a very powerful tool that could have both positive and negative impacts for students. On a positive side, students who had access to those would be able to nurture relationships very quickly in their educational program. Not only could they be exposed to the education, but they could go home and they could talk to people who had been through the same experience and receive mentorship from them. On the negative side, students with limited social capital without those experiences go home and in their concept of self-defined home front, which again is their home, their family unit, their neighborhood, their community, their church, their social circles, they may have very limited access to go home and say, what are these faculty talking about? How do I navigate all of these challenges ahead of me? So one of the missions of my life, as particularly as my mission as a faculty member, has been to explore strategies to help students supplement their social capital as a real key to their success.
What a wonderful story. And I suspect many of us, and I include myself in this, can hear exactly what you're talking about and perhaps felt those same sorts of things. So, how might we as nursing faculty use this concept to support students in a formal or informal kind of way?
Sure. So I started out, I guess, sort of informally, just sort of groping my way through my first years as a full-time faculty member. And I call this the power of the podium. As I was standing at the podium in my classroom, looking out over a class of maybe 75 students, I began to notice things. For example, the school where I taught had a relatively low diversity index. And I looked over to my left, and there was a young woman of color. She was sitting all by herself. And she reminded me of me when I was in college in that intense program. She had that deer in the headlights look. She had that look, and her eyes were literally saying to me, I feel like I might need some help. And she was very much to herself. So one day I asked her before class, would you take a quick walk with me? And we walked down the hallway, and there was a classroom down the hall of students in the level above her. They were juniors, and she was a sophomore. And I said, come with me. And I introduced her to another student, one of the only other students of color in the classroom. And we stood in the hallway, and I said, all I wanted to do was make an introduction here. And I turned to the junior and I said, pretend you're talking to yourself a year ago. What would you say to yourself? And can you please set up a time to meet with this other student and give tips and hints as to how to navigate the challenges of this program? So I found and I discovered very quickly, I started to help networking, which is a really key thing that we can help students do to augment their social capital. If they don't have a mentor at home, if they feel like they're lost in the program, we can actively seek to cultivate those relationships and to help them. Just this week, I actually spoke with a student, and she also is of a particular minority group. And she said to me, Dr. Foley, I feel lost, and I've never talked to anyone who's from my community who's a nurse. So I actually helped her. I reached out and got permission and linked the two of them up so that they could speak to each other. Essentially, what it means is many times we have a sense of comfort if we can talk to someone who reminds us of ourselves. And there's that immediate sense of rapport, and it really helped all of these students to be able to talk to someone who can help them. This eventually formally developed into a program that we developed, a formal mentoring program in the School of Nursing. And we did a series of wonderful events, one every semester, about 2 weeks in, when we welcomed new students. And we called it Walking the Red Carpet. And we had literally a red carpet event. And we invited students, faculty, advisors, even our dean came. And it was to level the playing field and engage with each other just as people. And the theme was just to come, and it was starring you. Bring the best of yourself. And we celebrate all aspects of our students' diversity. And they came in and they walked the red carpet, and we got pictures. And it was amazing that when the students entered that room, they began to table hop and meet each other. And I've often told the students, regardless of any factors that appear to be outwardly different, this group of students and these faculty are your best resource. And so sometimes we need to have those events when we meet each other as human beings and sort of reduce that sense of formality. At the end of that event, we had each of the students fill out a mentoring card. And if they wanted to request a mentor, we went into the room later, a couple weeks later, and we started pairing people up. Who do you think would be a good fit for this person? Sometimes we went to the community of interest and we found somebody outside of the school, perhaps an alumni, who would be able to speak with the student. And these types of active intervention where we really try to reach out and I think exercise and really take advantage of that faculty perspective, the power of the podium, we see the whole class. We're sitting there looking at a group of 100 students, each living their own experience. But I think we see the big picture, and I think it's our responsibility, in addition to teaching, to help students feel comfortable and create an educational environment where they feel very included.
I think that's really important. And I'd like to ask a question that I only thought of because of what you were saying. I have had times in my career that we have established mentorships with nurses and older students or whatever. And sometimes it works really well. And other times, I guess because people are busy or whatever, it is not as effective. Can you talk about how to improve that connection in some ways that at least my experience has been that they don't necessarily latch on to each other?
Sure. Yeah, on the back of that mentorship card, we actually asked the students, please describe your ideal mentor. What would they be? Would they be someone who's going to touch base with you often, just be there when you need to be approached? If it's a student who happens to be male, and we encourage them to be as descriptive as possible. Would you prefer to have another male student? Would you prefer to have a male mentor? Would you prefer to have a mentor where there's a cultural match? And I think we need to remember that I've seen some mentor-mentee relationships develop where there was really on the outward appearance no match whatsoever, but based on their description of what they wanted, we were able to help them find a mentor that met their needs. So I think we can't just reduce it to one dimension. I think we need to actually ask the student, what would they like in terms of a mentor? And then we went back in and we did that matching process, which probably took about 3 hours because we really wanted to be very deliberative and thoughtful in our approach. But we also did another thing. We encouraged the students, please approach us immediately if you feel that this mentor-mentee relationship is just not working out for you. Please approach us immediately because it's very important and we will try to find you someone else. So don't suffer in silence because this is really a key that can really help your success.
Thank you for that evaluation of how you can make mentorship better. I wish I had known that earlier in my career. I also often am concerned about the admission strategies that we use for admitting students. And I know we have moved toward a more holistic approach to our admissions, and that seems to be helpful in choosing the right students. But I always worry about how can we address faculty implicit or explicit bias in this process. I want to be sure that we're not using our own biases to affect what kinds of students we admit. And I had a colleague in the past who said, I can just look at them and tell who's going to be a good nurse. And I'm not sure that's possible. So would you address that some way?
Absolutely. So I think, first of all, I want to visit the topic of holistic admissions. And it took me a long time to sort of put this together and reconcile it. But when I was doing my doctoral research, I realized that I had been the recipient or the beneficiary, I guess, of a holistic admissions process 40 plus years ago in the early 1980s for that program that I described that I was admitted into. And when I was speaking with the dean of that program, we all had to have a mandatory meeting once a semester with the dean of this program. He asked me, where did you go to school? And when I mentioned the name of this inner ring suburb, I saw the nuances of his facial expressions and he just a puzzled look like, oh. And he looked at me and he said, oh, I thought you went to a good school. And so I said, ouch. So basically, I sort of saw red for a moment. And as he was speaking, I sort of saw his lips moving, but I sensed he was speaking, but I wasn't hearing anything. And I just said, with all due respect, I did go to a good school. And I feel like, and of course, that was sort of the passion of my youth and so forth. And I realized there was a lot of things, even though I had a 4.0 GPA, and even though I had some extracurricular activities, I recognized, and some letters of recommendation, I recognized that that 4.0 GPA from my institution did not equate to the 4.0 GPA of a very elite prep school where some of my colleagues were going. It just didn't, because they had
Mhm.
access to resources that I never had access to. So I think the concept of holistic admissions levels the playing field a bit. And incidentally, I was told that they reserved 2 spots for sort of underprivileged students. And it didn't dawn on me until I was in my 40s. I said, oh my gosh, he was inferring I was one of those underprivileged, lower middle class students in that program. And I really thought, wow, if they had been that intentional in doing that, I certainly wish they had taken that even further and said, once they get here, we're inviting them to the party, but now we need to invite these 2 students to dine or to dance.
Mhm.
And so they needed to have some supportive structures in place. So the holistic admissions process, as I know it today, and I understand it and I encourage it, there can be implicit bias. And I do know that my current university, the Ohio State University College of Nursing, requires mandatory training to examine bias before we can even participate in the holistic admissions process. And I'm very proud of that today. I think it really opens doors for a lot of introspection and reflection so that we can, carry on with our own journey of cultural competence as nursing faculty. However, I think when I look at what holistic admissions really embodies, it means that we don't just look at the GPA, we don't just look at the SAT scores, we don't just look at the entrance exams, whether that's the TEAS test or anything of that's used. We also look at other experiences that the students might have done. Perhaps they experienced some volunteerism. Perhaps they have some personal attributes. And maybe we might even look at letters of recommendation, anything that would tell them this student might not be bringing those experiences now, but they have a lot of very rich potential. But my best advice to anyone who is doing the holistic admissions process, which is very noble, and it's really answering that call for cultural diversity and equity in nursing as we strive to build a more, diverse nursing workforce in our increasingly pluralistic society, that it's really important that we also recognize that we have to have those supportive structures. Once we have the students come in through this holistic admissions process, we need to make sure that the students have adequate social supports. There's academic supports available, but do they feel comfortable? Do they have that sense of belonging? And if they can't go home and ask people at home or in their communities about this particular challenge of going through nursing school, can we step in as what Stanton Salazar calls empowerment agents? Can we step in? And can we empower ourselves to step in and stand in the gap for those students and help them navigate these institutional barriers that they might be facing, that they just don't know how to navigate?
Well, that is a really good response, and I think we all should listen to what you're saying and try to do that in all students that we deal with. In this era of limited resource in higher education and concern about DEI programs, do you have a recommendation for convincing administrators and others of the importance of addressing this social capital, this low social capital? I can imagine that in today's world, that might be a hard sell.
Well, here's what I would say. Many schools are fighting for survival financially. And so when I was doing my doctoral work, I looked at factors influencing NCLEX RN success on the first attempt. And I did that in a large urban university's pre-licensure programs. And we found out that the students, by and large, once we got to the end, the students who took the NCLEX exam, I did logistic regression and found out that we were race neutral, we were gender neutral, and we were also neutral for limited English proficiency. So that was good. Those did not appear to be predictive factors of success for NCLEX on the RN. But here was the bad news, and it was immediately obvious. The attrition rates for those students were horrendous, absolutely horrendous. So yes, everyone wants to protect their NCLEX first-time pass rates. But look at what we've lost along the way. We lost dozens of students that could have been educated and reflected a higher level of diversity in so many domains: gender, race, English, other languages other than English, who could have gone on to serve the public at large in a very competent manner, and especially in their own communities. And we lost all of that. So my best advice to faculty who want to say, what can we do to help students augment their social capital, is address with administrators that we're losing so many students. That's a loss of tuition dollars. It's expensive to have to keep admitting students. And it seems to do something to the culture of a school of nursing when you have a high level of failure rate. I know I always was very challenged by that as a faculty member, because you want the students to succeed. And what can we do to get together? And I worked with some wonderful faculty. We actually created a multicultural association of nursing students that was sort of ran in tandem or in parallel with our student nurse association. And we really tried to get the students involved in making our culture culturally inclusive. So just addressing with administrators that the bottom line is that we need students here to keep the lights on. And if we want to do that, we're going to need to change our thinking.
That is absolutely true. And I'm pleased to hear you talk about both the admission process and that support once students are in school. I once had an administrator and we had a bit of a drop in our NCLEX scores. And this administrator said to me, "Oh, Susie, just admit the smart students." And I didn't say what I thought, of course, but what I wanted to say was, you just tell me how to find the smart students, because you can't necessarily tell by some of the more common markers that people are going to be successful. So thank you very much for that. I'm sure that our listeners will respond to what you have to say. Our time is getting close to the end. So let me ask you, what is the final words that you would say to us with regarding to this topic?
I think that I would just conclude with is that on so many levels, this embracing students' success, regardless of who they are, and striving to create a culture where the students feel comfortable, where they feel comfortable accessing resources, they feel comfortable approaching faculty, where they're working with mentors. It's really helped me reconcile so many experiences in my life, and it's been so fulfilling. So it really makes me repeat what someone told me a long time ago: everything happens for a reason. And I'm very appreciative of the road that has led me here today and the chance to be able to share all of this with you. So thank you so much.
Thank you. We really appreciate it. And I certainly am one who agrees that all the things that happen to us, good and bad, do affect who we are and can be a really good thing. And you are certainly an example of that. Thank you so much.
Absolutely. Thank you.